Now, ICUs are being overwhelmed as the climbing COVID case count putting a strain on our healthcare system. Yet again, local hospitals continue to transfer COVID patients to other sites that have available space. Now, let's talk about how the new Cortellucci Vaughan Hospital has been handling COVID patient transfers, because as we know, they opened up strictly to do just that. Joining me now is President and CEO of Mackenzie Health, Altaf Stationwala. Altaf, good morning to you.
Morning, Melanie.
I want to actually first begin with the vaccine efforts, because Cortellucci Vaughan, I know, has been part of the process as well. Will Cortellucci Vaughan be shutting down at any point or pausing vaccinations, as we've heard from Wonderland and a few other sites?
So we are using the Pfizer vaccine, so we are in a place where we have ample supply. So we continue to do anywhere from 600 to 800 vaccinations a day. So no, we continue to be an active vaccination site.
Okay, so that's great news for York Region residents. So let's get to what is happening in the hospitals. And I know you can obviously speak to what's happening at the Richmond Hill site as well as at Cortellucci Vaughan. So let's first start with Cortellucci Vaughan. Opened up, just over a month ago, and there was a lot of excitement in that, hey, this is going to help take the strain off some of these GTHA hospitals with transfers. Now, I think your beds are getting fairly full.
Yeah, we are getting full. So we've taken, since we opened on Feb the 7th, 230 patients to date from neighboring hospitals. 53 of those would be ICU, 173 medicine patients. So, we've been actively taking patients, discharging patients as well. But it is getting to that point where we're almost getting to that threshold of capacity in the ICU area.
Altaf,
our biggest concern.
Where are these patients being transferred from specifically?
So they're typically GTA hospitals, William Osler, South Lake, North York General, Humber, Scarborough. Those have been the main hospitals that we've received patients from. But we know that the GTIMS is there to really level load across the province. So it's not about overwhelming one hospital or necessarily just using Cortellucci Vaughan exclusively. So it's a load balancing, especially on proactive moves that happen early in the week.
We are constantly looking at the numbers here, Altaf, and they're a little bit different from what we see from the Health Ministry and versus what Critical Care Services Ontario puts out. Regardless, they are concerning numbers with the amount of patients who are in the ICU. For our viewers to understand how significant and how big of a strain it is right now on all of our healthcare workers, can you paint a picture here?
Yeah, Melanie, I think what's different this time around for this third wave. So if we think about the first wave, we peaked and then we did have sort of a trough in the summer where actually we got down to about 11 ICU patients in the province. So that was on August 23rd. The bottom of the second wave, which is sort of the end of February 20th, we've sort of hit that bottom with 263 ICU patients. So we didn't really have a trough. So we're already pretty well at capacity, and now we're entering that third wave. So for us, every day we're trying to balance the load between our emergency department at the Mackenzie Richmond Hill Hospital, take patients from other hospitals at Cortellucci Vaughan Hospital, and just ensuring that we can manage the flow of patients, not just from our two hospitals, but supporting other hospitals as they get into trouble. So it's day. Directives are typically issued at the beginning of the week, and we try to fulfill them as best as we can. But at the same time, I think we're all getting to that place where we're getting to that threshold of capacity within the GTA and Hamilton region. And obviously that's causing us to look at patients being moved to outer regions such as Kingston and other jurisdictions.
Yeah, indeed, it is concerning, and we need to stop this right now so that we don't see those trends continue to go higher. Thank you for your time, and please do express our thanks to all of those who are working with Mackenzie Health for all the work that you do throughout the year and beyond. Thank you.
Thank you, Melanie. Have a great day.
You too. It is 7:10 right now. We're going to continue to give you news coming up in just a bit. Right now, over to Dee and Sid, the birthday boy.
Yeah.